Imagine you wake up with a pounding headache. You reach for an aspirin pill, you swallow it, and within an hour you feel the pain phase away. Or consider a child with asthma who inhales a puff from an inhaler and can breathe freely within minutes. How do these medicines know where your pain is? And how do they open your airways in this case? In today's episode, we're going to unlock the secrets of how medicine works in our body. We'll explore everything from how a pill travels through a system to the cutting edge of gene editing therapies. Along the way, we'll use real world examples from antibiotics that kills bacteria to gene edit that added genes to cure diseases. And all of these are going to be explained in accessible ways. So get ready. Let's just start our journey at the beginning. So what happens from the moment you take the medicine to the moment it makes you feel better? So when you first swallow a pill or get a shot, drug doesn't magically teleport to the problem spot. It goes through a complex journey in your body. Pharmacologists break this journey into two big ideas or two big parts. That is pharmacokinetics and pharmacodynamics. Those are hefty words, but they really boil down to 2 points: what the body does to the drug and what the drug does to the body. So, pharmacokinetics is often summarized as ADME, which stands for absorption, distribution, metabolism, and excretion. Imagine you take an aspirin pill for your headache. First, it absorbs. It dissolves in your stomach or intestines and enters the bloodstream. Next, it distributes, which means it rides the bloodstream like a highway and is spread throughout your body. It doesn't know to only go to your head. It goes everywhere essentially. But we'll see soon how it targets the pain. Then your body breaks down the drug mainly in the liver, and then break down the drug, kind of like a chemical recycling process, and finally it excretes. Your kidney or liver or lungs, for some drugs, flush down the remains. In short, pharmacokinetic is a chart of drug life cycle in your body, how it gets in, and where it goes, and how it's changed and how it leaves. Now into pharmacodynamics, which is essentially how the drug works in your body. So, continuing on our aspirin example, once distributed, aspirin molecules will find their targets. In this case, that is enzymes involved in pain and inflammation, and it'll bind to them to reduce pain signals. Pharmacodynamics is about these effects and mechanisms. A simple analogy is a lock and a key. The drug is the key and it fits into the lock. We'll go into that more later, and the key go into the lock, and that triggers a response. If pharmacokinetics is the travel itinerary, pharmacodynamics is like what happens at the destination. So together they explain why you need a certain dose of aspirin and how long it will take for it to work. Essentially, again, pharmacokinetics is the movement of the drugs through the body, and pharmacodynamics is the body's response to the drug. A real world example would be, think of insulin for diabetics. After injection, insulin's pharmacokinetics involves absorption into the bloodstream and distribution to tissues. Its pharmacodynamics is how it binds to receptors on cells, like a key in the lock essentially, and tell those cells to absorb sugar from the blood. Both aspects are crucial. If insulin isn't absorbed, say due to poor injection techniques or degraded insulin, it can't lower blood sugar, which means there's no effect. And if it binds too well or too long, the blood sugar might drop too much. And insulin is a very interesting example of a drug. We might get into insulin in later episodes, but for now, um, now we're looking at all the kind of drugs. So now that we have a high level map of the drug's journey and action, let's open the medicine cabinet and see the different types of medicines that accomplish these feats, from tiny chemical pills to cutting edge vaccines. So not all medicine are created equal, meaning that not all of them are the same or works the same way. In fact, medicine is referring to a very broad variety of substances working in very different ways. So let's break down some of the main categories of drugs and provide you with some insight of how they work. So a lot of them you might already have heard of, and I will also give some examples. So first is small molecule drugs. These are classic pills and capsules such as aspirin, blood pressure meds, etc. And they're made from simple chemical compounds and have low molecular weight, which helps them easily enter the cells and do their job. You can swallow them as tablets, liquids, or even use them as creams. Most prescription and over-the-counter meds fall into this category. For example, ibuprofen for pain, or some other pain relievers that you take for, and also the meds for cholesterol are typically small molecules, and they're relatively easy to manufacture, and they're often cheaper. However, because the molecules are very small and they're just simple compounds, they sometimes affect multiple parts of the body. Means that they bind to different enzymes. So we'll mention that later. Means is essentially what that means is it's less targeted and less specifics, which means it can lead to more side effects. Moving on to biologic drugs. Biologics are medicine that comes from living organisms or contain components of living things. They include big complex molecules like proteins, often over 1,000 times larger than a small molecule. A common type is monoclonal antibodies. Imagine a tiny guided missile made of protein that can seek out specific targets in the body. Because biologics are proteins or other large molecules, you usually can't take them as just pills. Because think of it, your stomach, and not just your stomach, but your whole digestive system would destroy it, break it down, and then it no longer works, right? Instead, they're often given by injection or IV infusion. Examples include insulin. It's historically derived from animal, meaning we get it from animals, and now they're made by bacteria with recombinant DNA. Or it might also be antibody drugs like um, Humira for autoimmune diseases. And biologics are very specific in what they target, which is great for reducing off-target side effects, but they are very expensive and may be more fragile. They've revolutionized treatment for conditions like uh, cancer, by specifically targeting molecules, and many other different kind of diseases. In the case of cancer, for instance, an antibody could that latches on an inflammatory signal protein could neutralize t- not just cancer but all specifically targeted molecules. Moving on to the next type, which is antibiotics, which we've all heard. These are drugs that fight bacterial infections. The key is that they selectively target bacteria without, in theory, harming your human cells. Meaning that sometimes, or most of the time, they do, in to some extent, harm normal and healthy human cells. So many antibiotics do this by exploiting do try not to harm your human cells by exploiting differences between bacterial cells and human cells. For example, penicillin stops bacteria from building their cell wall, which is a structure that human cells or all animal cells don't have, resulting in the bacterium bursting from its own pressure. Antibiotics either kill bacteria outright or stop them from multiplying, which gives your immune system a chance or some time to mop up the invaders. They come in pills, liquids, injections, or even topical creams. This is important to It is important to know that antibiotics do not work on viruses like a cold or a flu, and also overusing or misusing antibiotics can lead to a resistance, making like a super bacteria, like bacteria developing shields against these drugs. So they no longer work anymore. So that means we should take antibiotics exactly as prescribed. So since antibiotics don't work on viruses, what does that? Where we have antivirals. As the name suggests, antivirals fight viral infections. Viruses are very different from bacteria. They hide inside our cells, which makes them kind of tricky targets. An antiviral drug typically interferes with the virus's life cycle. It might block the virus from entering our cells or prevent it from hijacking cell machinery to copy itself. Or also, it might boost the immune response against it. Unlike many antibiotics that can tackle a broad range of bacteria, antivirals tend to be more specific, often designed for maybe one particular virus or family of viruses. For example, Tamiflu helps against influenza by blocking a step the flu virus needs to spread, and also antiretrovirals for HIV blocks the virus's enzymes to stop it from multiplying. Antivirals can come as pills, inhalers, IV meds, even ointments for viruses like herpes. They don't necessarily kill the viruses outright in most cases, but rather inhibit them, reducing the severity or length of the illness. So, oftentimes, the timing is key. You often need to take them early in an infection for the best effects. Moving on to vaccines. Vaccines aren't necessarily drugs in the traditional symptom relief sense. They're more like teachers for immune systems. A vaccine introduces your body to harmless versions or pieces of a pathogen, which means a virus or a bacterium, training which trains your immune system to recognize and attack the real thing if it ever shows up. Vaccines can contain weakened or inactivated microbes, fragments of them, or even just the genetic blueprint that tells your cell to produce a distinctive piece of the germ. They don't cause the disease, but it does trigger an immune response. Your body essentially practices on a fake target so it can respond faster and stronger to the real infection in the future. For instance, the flu shot contains pieces of the influenza viruses. Your immune system produces antibodies, which are protective proteins, against those pieces. Later, if you encounter the actual flu virus, your body remember and neutralize it before it makes you very, very ill. Vaccines are preventative medicine at the finest. Thanks to them, we've eradicated smallpox and drastically reduced diseases like polio and many, many others. They're usually given in injections, though some are taken by mouth or nose. As you can see, medicine ranges from tiny chemical to engineered antibodies to biological preparations like vaccines, each working differently. A small molecule like a decongestant might open nasal passages by chemically signaling blood vessels to constrict, while vaccines prep you for future battles by spurring your immune system. Modern medicine often blends these approaches. For example, treating HIV involves both antivirals to suppress the virus and maybe vaccines in trial, plus managing symptoms with regular small molecule drugs. It's truly a diverse toolkit. If you ever, if you've ever needed quick pain relief, some drugs act fast, while others might take weeks or even months to have full effect. So why do some medicines kick? in almost instantly, and other make us wait. So let's talk about the speed of the medicine. So you've likely noticed in your own life that some medicines, like under the tongue nausea tablets, when you take them, you feel better almost in 4 or 5 minutes. But when you start like a daily allergy pill, it might take a few days to build up relief. And when you get a vaccine, it could even be a couple of weeks before you're actually protected from the disease. The onset of action, how fast the drug starts working, can depend on several factors. One major factor that maybe people will notice already, it makes sense, is route of administration. If a drug goes directly in your bloodstream, it can start working very quickly. For example, IV injections or inhaled medications can produce effect within seconds to minutes. On the other hand, a drug taken orally typically takes a bit longer, often around 20 minutes to an hour, to be absorbed and take effect. And this is because swallowed pills take a long road, right? They go through the whole digestive system, and uh, then it gets absorbed into the blood bloodstream through the intestinal lining. Sorry, and but there are exceptions. For example, alcohol absorbs a bit in the stomach, which is why drinking on an empty stomach hits faster. But generally, the stomach intestine route is the bottleneck. In fact, if you have a full stomach, it can delay the drug's onset because it sits in your stomach longer, right? Beyond the route, formulation of the medicine plays a key role. So some drugs are designed itself as fast acting formulas, and while others are extended release or delayed release. If you see XR or CR on the pill bottle, it means that the bottle is crafted to dissolve slowly at a certain point in your digestive tract. To do that, they may have a film on the drug, so that's why you shouldn't break some drugs before you take them. And it might be other mechanisms, and this can spread the drug's action out over 12 to 24 hours. So you don't have to take it often, and it maintains a steady level. In contrast, an immediate release uh, from from dump to the medicine and quickly for rapid effect might not last as long. Again, for example, there are acting insulin injections for mealtime blood sugar spikes, and also there are long acting insulins that slowly release over a day to provide background control. The chemical nature, similar to the formulation, kind of similar of the drug, also matters. For example, small lipophilic, which means fat-loving molecules, might zip through cell membranes faster, while larger or water-loving molecules uh, take more time. So in drugs, if a drug's mechanism relies on cumulative changes in the body, it will be slower. A good case is antidepressants. An SSRI antidepressant doesn't produce mood improvement in days because it works by gradually adjusting neurotransmitter levels and even prompting neuronal changes, process that unfolds over weeks. In contrast, a sedative like diazepam can make you relax within an hour because it directly and immediately enhance the inhibitory signals in your brain. There's also a factor of targets and feedback loops. If a drug directly relieves a symptom, say a nasal decongestion, that physically constricting blood vessel in your nose, you feel the effect rather quickly. But if it's triggering a cascade, that cascade can take time. Vaccines again are a good example. They don't confer protection until your immune system has built up and multiplied the specific memory cells and antibodies. That's why there's a waiting period after vaccine before you're fully protected. Lastly, Individual differences can make a drug seem fast in one person and slow in another. We'll dive in more into that later. But for instance, a person with a super efficient liver might break down the drug quicker, so it peaks and fades out faster, whereas someone else's body might absorb it more readily and get a quick high concentration. That is why prescribing medication for children are often much harder, because it's hard to know what stages their organs are in and how developed and how efficient they are. We've talked about getting the drug into your system, but how does medicine actually know where to work or what to do? The truth is, it doesn't have consciousness, right? It's all about molecular interactions, essentially chemistry. And next, we'll explore how drugs find their targets in the body and how they can affect exactly the part we want. Medicines are like messages, but they need a receiver. In biological terms, a drug's target is usually a molecule in the body, often protein that drugs interact with to produce its effects. The classic imagery is a lock and a key model, which we've mentioned. The target, say the receptor on a cell or an enzyme, is a lock, and the drug is the key that fits into it. When the key turned, something happens. The door opens. Uh, a signal is sent essentially, and a reaction or blocked, or other stuff happen in your body. Let's break down a few common target types, and give you some analogy for understand help understand. The first target are receptors. Think of a cell as a busy office, but with locked doors, which are the receptors here. The locked doors are on the cell surface, and a receptor is essentially is a protein that certain signaling molecules naturally fit, like how adrenaline fits into beta receptors on your heart and make it beat faster. Drugs can be designed to mimic these natural keys or block them. For example, a bronchodilator inhaler for asthma contains a drug that mimics adrenaline on lung cell receptors, telling airways to relax and open up. Conversely, a beta blocker for blood pressure sits in the lock and taking the place and prevents adrenaline from overstimulating your heart. The drug's shape and chemical structure determines which receptor locks it can fit. This specificity is why a heart medicine doesn't generally cure your headache, or why antihistamines target allergy receptors and not your liver cells. However, if a drug is not very selective, it might fit into similar locks elsewhere. That's when you get side effects. For instance, a very good example that probably everyone notices. So older antihistamines fit allergy receptors, but they also hit receptors within your brain that makes you drowsy. That's why oftentimes after you take an allergy pill, you feel sleepy, but new drugs have a way to prevent that. So moving on to enzymes, which is another common type of target. So enzymes are essentially proteins that facilitate chemical reaction or catalyze chemical reactions in the body. Uh, they're like the worker bees or machines on cellular assembly line. A drug targeting an enzyme often aims to inhibit it, like throwing a wrench into the gears. Another possible target will be DNA or RNA. Some drugs go straight to the genetic material. Chemotherapy, for example, it, it often binds to DNA or block the machinery that duplicates DNA, because cancer cells are just dividing rapidly and creating tumors, and they need to copy their own DNA to proliferate. By jamming up the DNA replication, these drugs cause rapidly dividing cells to die off. Essentially, they can't divide anymore. Downside is that they can also affect some healthy um, and fast dividing cells too, like cells on your hair or some cells on your gut lining. Hence, there's hair loss and nausea in chemo. There's also antiviral drugs that target viral DNA slash RNA or the enzyme that replicates them. Essentially, they're sabotaging the reproduction of the virus without affecting our own DNA, if done correctly. And as we'll discuss in the next segment, some of the new therapies actually edit DNA intentionally for beneficial effect. So we've been talking about traditional drugs that mostly bind to target to influence bodily processes, but what if instead of just sending messages or blocking locks, we could rewrite the body's code entirely to fix a problem of its source, right? If like um, now modern drugs typically they, for example, after you build a building, you find that there's defects, there's shaky walls, and there's stuff around here and stuff around there. So you go to fix it. But what if we can fix the blueprint itself, the blueprint of the building itself, so that it doesn't have problems? It sounds like science fiction, but with gene editing therapies like CRISPR that I've talked about for the past two episodes, it's becoming reality, and I want to dig deeper into. Although we have already touched on some gene editing therapy in past episodes, but I like to get a little bit more in depth with the gene editing therapies. It's not just CRISPR, but there's stuff beyond. So pick first, just picture a DNA. It's a genetic code in each of your cells, right? As it's an instruction manual for building and running your body. What if there's a single typo in the manual that causes a disease? In a building or a blueprint, that might not be too big of a problem, but in a in real world cases, a single typo in an important place might cause a very big problem. So traditional medicines usually cope with the typo's effects, but gene editing therapy it aims to fix the typo itself. It's like using molecular pencil or scissors to correct the DNA, or like using pencils and pens to correct the blueprint. The star of gene editing conversations is CRISPR-Cas9, which we've talked about a lot. CRISPR, again, is if you have missed the first two episodes, it's often described as molecular scissors. In illustrations, you can see a Cas9 enzyme. The scissor being guided to a DNA strand by an RNA guide, which is the ribbon. Scientists can program this RNA guide to match any unique DNA sequence. Say the spot of mutation causing a disease. The Cas9 then cuts the DNA at that spot. Once the DNA is cut, the cell will try to repair it. At that moment, if we introduce a correct version of the gene or some modified sequence, the cell might paste it in, effectively replacing or fixing the original faulty code. In simpler terms, CRISPR allows us to add, remove, or replace bits of DNA at a specific location. If you're really interested in how it works, you can check out the first episode, explain the mechanism of CRISPR and how it was invented. So how's this different from traditional medicine? It is fundamentally a curative at the genetic level. Instead of needing a drug every day to manage symptoms, a successful gene edit could permanently correct the underlying cause. For example, it is consider sickle cell disease, which is a common genetic disease, and which is caused by a mutation in the gene for hemoglobin. That is the protein in our red blood cells that carries oxygen. This mutation essentially causes the red blood cell to become misshaped and leads to all the disease problems. Traditional treatment for sickle cell involves medication to manage pain or blood transfusions. etc. But they don't essentially fix the root cause. In 2013, scientists actually achieved a milestone. A CRISPR-based therapy that edits the patient's own bone marrow cells to alleviate sickle cell. Doctors extract the patient's blood stem cells, use CRISPR to disable a gene that was preventing fetal hemoglobin production, and then put those cells back in. The result? The edited stem cells produce fetal hemoglobin, a form of hemoglobin that doesn't sickle, and effectively cures the disease or greatly reduces the symptoms. And in clinical trials, the vast majority of patients treated this way stop having the severe brain crisis that defines sickle cell. It's like a one-time fix. You take the drug one time, and their body can now make healthy red blood cells continually. So CRISPR isn't the only gene therapy approach. There are also older methods using viruses as delivery vehicles to add genes. Of course, gene editing therapies are still relatively new and often very, very expensive, and there are often very complex procedures. Unlike a pill you pick up in the pharmacy, they might involve extracting cells, editing them in labs, and reinfusing them, or giving an infusion of gene editing components that have to find the right cells. They also carry risks like immune reactions or off target edits. As we mentioned in the first episode, um, because human DNA is a very, very long sequence, there might be repeats, right? If they target the wrong sequence, it might have a very severe side effect. So the medical community are still very, very careful in conducting many, many trials to ensure safety. Although I think there is a drug for sickle cell disease that is already on the market, you can search it up. But as you can see in the video that introduces the drugs. They're very, very long. Um, there's a very, very long part of disclaimers talk about how the drug could work and how they haven't seen any side effects or they haven't had any off-target edits. It's a very long disclaimer, which like in some sense shows the risk of these therapies. Another difference is regulation and permanence. When you take a drug, if you get side effects, you can stop taking it and the drug will wash out. With gene edit, you can imagine once done, it's done. For better or worse. That raises the stake even higher on safety, but also is what makes it so potentially transformative. One successful gene therapy might could last a lifetime. It also could affect you in a negative way for a lifetime. So as of now, gene editing therapies, including CRISPR, are still being in the stage of being explored for conditions like blood disorders. As of now, gene editing therapies are still being explored or used for conditions like blood disorders, certain cancers, and rare metabolic and neurological diseases, and even sometimes infectious diseases. But in 2023, the first CRISPR-based medicine was approved, as mentioned, for blood disorder and making essentially a new era. To paint a picture, if your body is a complex machine, traditional drugs are like tools that tweak the machine's operations, whereas gene therapy is like opening the machine's blueprint or fixing blueprint errors so that the machine itself corrects. Yeah, that's a way better example than the building. So both approach will likely coexist. You might cure genetic diseases with gene editing, but you'll still use traditional drugs for many acquired illness or temporary relievance. It's just another approach, and maybe a revolutionary one, and it adds something to our medical toolkit, right? Now, even with all of these amazing therapies, from old school antibiotic to futuristic gene editors, anyone who talk to other patients know that the same medicine doesn't always work the same way for everyone. Why does your friend swear by a certain antidepressant that did nothing for you? Why might one person get terrible side effects from a drug while another feels fine? In our next session, we'll explore the fascinating reasons behind these individual difference in drug responses. There is still so much to talk about medicine, such as why medicines work differently for different people, and why someone gets a side effect, someone doesn't. And also, there are more futuristic medicine like smart drugs, personalized therapy, AI design treatment, and nanotechnology. These are so cool, very very cool. But because of time, we might have not have the time for to talk about all of these in this episode. So some closing thoughts. It's truly an amazing time to be a science curious observer of medicine. We've started with ancient healers giving herbs, and now um, the we have the power of editing gene and designing drug with computers, right? Yeah, if you think about it, the core principle hasn't changed. We seek to help the body recover balance, whether by aiding its natural signals, fighting external invaders, or correcting internal errors. Next time you take any medicine, from a simple aspirin to a complex biologic to or maybe even gene editing pill, you'll know the incredible journey it undertakes and the sophisticated science that made it possible. Who knows what the next big breakthrough will be? Perhaps one day a future podcast will be talking about microscopic robots delivering drugs cell by cell, or like with quantum computers, like with that have quantum biology based medicine. Until then, I'll remind you to stay curious and remember that little pill or shot represents centuries of learning of the human intelligence, and to answer the question how medicine works. And the learning continues for human beings, maybe faster than ever. This is Unlocking Science. See you in the next episode.